And hopefully everyone can also see the PowerPoint. So we are talking about blood pressure and coronary artery disease. So let's start with what blood pressure is. So blood pressure is the pressure of blood pushing against the walls of our arteries. So arteries carry blood from our heart to other parts of the body. Blood pressure normally rises and falls throughout the day, but it can damage our heart and cause heart problems if it stays high for too long. Hypertension, also called high blood pressure, is blood pressure that is higher than normal. So uncontrolled high blood pressure is one of the leading causes of death in Canada. It can cause strokes, heart attacks, heart and kidney failure. It is also related to dementia. These problems can be prevented if blood pressure is well treated and controlled. Normal blood pressure allows our blood to flow and deliver oxygen and food to different parts of the body. So that's the main job of our blood pressure. It needs to be at a stable level so that blood can flow through our arteries and go to the places that need it. So we measure blood pressure with two numbers. So for example, 120/80. So the first number is called the systolic blood pressure and the second number is called the diastolic. So whenever you're looking at your machine and you see those two values, it's systolic blood pressure over diastolic. So think of S over D. So systolic blood pressure is your highest blood pressure, and it is when your heart contracts. So when your heart squeezes, the pressure that comes from the heart and goes into the arteries that go all throughout our body, that is your systolic pressure. It's from when the heart is squeezing, and just think of a hose. Now that there's a lot of pressure going through that hose, it kind of pushes on all the arteries. That gives you your systolic reading. So when you're seeing that 120, that's from your heart squeezing. The diastolic pressure is your lowest blood pressure measurement, and it's when your heart is relaxed and filling. So when your heart squeezes, you push out a lot of pressure and a lot of blood out into the arteries. That's when you get your top reading. And when the heart is relaxing, now the pressure in those arteries, for example, this picture here, think about this, when the blood is pushing into this artery and your heart is squeezing, that's a lot of pressure coming out and pushing against the walls of this artery. And then when your heart relaxes, this artery starts to shrink back and you don't have as much pressure pushing on it because the heart is relaxed. So that's where you're actually getting your reading of that 120/80 or whatever the value may be. And so the higher your systolic or your diastolic pressure is, and the longer it stays high, the more damage is made to your blood vessels. So again, this is the artery. Think of this as the artery. This is an unhealthy artery. You can see the yellow here. There's some plaque and things that are built up from things like cholesterol. But your artery is a tube. Think of it as a hose. It's meant to have blood flow go through it. But if the pressure in that artery stays high for too long, we tend to have it where it starts to wear out. It's an elastic tissue. So over time, it gets weaker and weaker and the blood pressure gets higher and higher. And it's harder to get that blood flow to different parts of your body. So strokes and heart attacks are caused by these damaged arteries. So when these arteries become damaged, it's a lot easier for plaque and things to get stuck in these arteries. And when you have a blockage in these arteries, that's when you have things like heart attacks and strokes. Moving on. Here we go. So talking about those blood pressure readings. So remember, the top number is when your heart squeezes. The bottom number is when your heart relaxes. So a low risk blood pressure is when you start to see values about 120/80 or lower. Medium risk, when we start to creep up to about 121/139 for that top number. So you see where it says 89, that would be your top number. And when the second value is between 80 or 89. 120/80 is your standard blood pressure. That's what we're aiming for it to be at that level or lower. When our blood pressure is at that level, it's very easy for different parts of the body to get enough blood flow as they need and for things to function nicely. So 120/80 is optimal. Anything that is a bit above, like when we start to get to 121/139 and 80/89, those are now getting above that 120/80. We consider that medium risk, and it's considered to have high blood pressure when we start to get to values of about 140/90. So instead of that 120/80, we're now pushing up where there's more pressure being put into those arteries that often can't sustain it. And we start seeing numbers like 140/90, 190/100, those numbers that are both higher than that 120/80, which is optimal. So when we talk about blood pressure, we tend to always talk about hypertension, which is high blood pressure, but it's also important to spend a few seconds talking about low blood pressure. So low blood pressure, sorry, is called hypotension. And it's when the pressure in your arteries drops below the normal range. So it drops below that 120/80. But blood pressure levels below 120/80 may be normal for some people. So often people that regularly have hypotension, that low blood pressure, they sometimes feel dizzy when going from a seated or a laying down position to a standing position, which is often because the pressure is so low in those arteries that I was talking about, where they function best at that 120/80, that when they are lower than that, it is hard for the brain to get blood flow to it quickly, because you're not getting enough power and pressure to the brain to get that blood flow. So people that have hypotension, blood pressure is below 120/80, often have that dizzy feeling sometimes when going from a seated or a laying down position to a standing position.
They began a reopening investigation, and as prosecutors began investigating the anomalies and how the case was handled. They also discovered
I'm hearing a TV in the background. I'm just trying to mute that person's mic.
I got it.
Thank you.
Apparently not.
There was a woman driving by, being fired a shot at the driver, and wanted to commandeer her car. She said,
Perfect.
There, I got
Thank
it.
you. Thank you. Thank you. Okay, so which number is more important? So often more attention is given to the systolic blood pressure, so that first value, as a major risk factor for heart disease. In most people, systolic blood pressure rises with age due to increased stiffness of the large arteries and long-term buildup of plaque. So that's why they always say try to control your cholesterol when you're younger, because the plaque just continues to build up and build up in those arteries. Remember those hoses that I showed you? And as well as you get older, our elastic tissue starts to wear down, so those arteries become a little more stiff. So that is why systolic blood pressure tends to sometimes rise with age. But either having an elevated systolic or elevated diastolic pressure reading can diagnose high blood pressure. So a lot of time we take emphasis on that top number, but if either the top or that bottom number is above that 120/80, we can start to get close to diagnosing someone as having high blood pressure. So people often think that there are symptoms and signs of high blood pressure, but most of the time there are none. So there's a myth where people that says that people with high blood pressure will experience symptoms like nervousness, sweating, difficulty sleeping. The truth is that high blood pressure is usually symptomless. It's called a silent killer. So that's why it's important to have your blood pressure checked regularly. So there are actually no symptoms that actually let you know that you have high blood pressure. Sometimes people say that they feel like an aching in the top of their head. They'll say that they feel nervous or sweating, but blood pressure really doesn't have any symptoms. So when your blood pressure isn't managed well for long periods of time, it can lead to increased risk of a few of these things. So stroke, vision loss, heart failure, having a heart attack, kidney disease and failure, or sexual dysfunction. This all makes sense because blood pressure has to do with those arteries that go from the heart to the rest of the body, making sure that that artery is healthy and getting blood flow to different parts of the arteries. Different parts of the body. So if you start to have it where that blood pressure is too high, it starts to affect things like the stroke, which has to do with blood flow getting to the brain, heart failure, which has to do with blood flow getting to the heart, vision loss. We have arteries that go to our eyes to supply blood. So any of these things that have arteries, which is pretty much every part of our body, it is greatly affected by managing our blood pressure. So non-modifiable risk factors. So risk factors that you can't change in terms of your likelihood of having high blood pressure as you age. So first one is family history. So if your parents or close blood relatives have high blood pressure, there's an increased chance for you to have high blood pressure. Another one we can't change is age. So the older you are, the more likely you are to get high blood pressure. As we age, our blood vessels gradually lose some of their elastic quality, which contributes to an increased blood pressure. So when we have it now where those arteries, because we're getting older, the elastic tissue starts to wear down, it makes it that it's a lot harder for blood flow to move through easily, and we can't control that. Gender, so until age 64, men are more likely to get high blood pressure than women are. At 65 and older, women are more likely to get high blood pressure as their hormone levels change. What else can't we change? Race. So African Americans tend to develop high blood pressure more often than any other race. Science still hasn't found out why that is, but there's some thought that it's possible that there's a gene passed down to some Black people that make their body more sensitive to salt, because they found that there are a big pool of African Americans that still have high blood pressure even when they look at their diet, their exercise, and things like that. And they notice that it's a trend that sometimes falls through genes. So we're still looking into that. And another thing we can't change is chronic kidney disease. So high blood pressure may occur as a result of already having kidney disease, and having high blood pressure may also cause further kidney damage. So that's why it's important that if you do have high blood pressure, to try and manage it so that you're not making your body work harder than it needs to keep you to do your day-to-day activities. So risk factors that you can change. So these are some things that you should try to avoid. We do have some control over some of these factors here. So for example, lack of physical activity, that increases your risk, your chance of your blood pressure becoming higher. Having an unhealthy diet, especially one high in sodium. Being overweight or obese. So carrying too much weight puts an extra strain on our heart and our circulatory system, and those arteries that carry blood flow when we're taking our blood pressure, that's part of our circulatory system. So drinking too much alcohol, this can also cause your blood pressure to increase temporarily. Having sleep apnea. So when someone's breathing stops and starts when they sleep, it's often seen with some people that snore loudly. This increases your chance of having high blood pressure. High cholesterol. So more than half of the people with high blood pressure also have high cholesterol. And so it's important to try and keep that minimized as much as possible. Diabetes, we can also control what our levels are there. So most people with diabetes also develop high blood pressure because diabetes can sometimes damage those arteries already. Smoking and tobacco use. So using tobacco can cause the blood pressure to temporarily increase. And lastly is stress. So these are all things that we have some control over, and we should try to keep them as well within the normal limits as possible, so that our blood pressure, if we already have high blood pressure, it doesn't get much higher, or our arteries aren't taking on that much more strain, and also to avoid high blood pressure altogether. So what can we do? So having your blood pressure checked regularly, that's something you could do to see where to have an idea of where your blood pressure lies and to keep track of it. We can reduce the amount of salt we eat. So a lot of salt is found in processed foods. So things like fast food, prepared meals, processed meats, canned soups, salad dressing, packaged sauces. For all of these to be preserved, they have to have a lot more salt in them. And so that does go into your sodium. Salt is the same word as sodium. So it does go into your salt intake. And we're trying to minimize the amount of salt we eat to keep our blood pressure as low as possible. So you want to try to limit your salt intake from your cooking and at the table. So sometimes people will try to avoid having that salt shaker on your table so that you're not tempted to add more salt to your food. Because it is recommended that Canadians eat less than 2,300 milligrams of salt a day. What is that? That is 1 teaspoon. So thinking of all of the meals you have throughout your day, we should not be having more than a teaspoon of salt a day. So think about when you fry something, when you cook something that's already packaged food, a lot of it has a lot of sodium. And so it should be that throughout the day, you have less than a teaspoon for all of your meals throughout the day. So keep that in mind. What else can we do? We can eat a healthy, balanced diet that is lower in salt and fat. There are resources such as a DASH diet, which is created to lower blood pressure. So a DASH diet focuses on vegetables, fruits, whole grains, and protein, healthy fat and dairy foods. It is also low in saturated fat, salt, and sugar. So for some people that have a hard time managing their blood pressure, and if it has to do with the amount of sodium sodium/salt that they're eating, they may try to do a DASH diet to get their blood pressure a bit lower without having to resort to medication. What else can we do? We can be physically active for at least 150 minutes per week. So VV's also has fitness workshops. So if you think about that, that's an hour, that's 60 minutes per session. You want to try and have about 150 minutes of physical activity per week. You also want to achieve and maintain a healthy body weight. You don't want to put too much stress on your arteries where they have to work even harder and strain even more. You don't want to smoke. You want to try and limit your alcohol use. And you want to find healthy ways to manage your stress, such as physical activity, socializing, laughter, and healthy eating. So laughter is a big one there. Laughter can really help keep your blood pressure down. So finding ways to enjoy life and to manage your stress really helps take off some of that strain on those arteries. So next, let's talk about readings. So incorrect home readings happen frequently. So see if you can pay attention to these steps here and see if there's any, when you're checking your blood pressure, if there's any of these things that you aren't doing. Because a lot of the time we have those in-home machines, but if we're not using them correctly, we can sometimes get increased readings or reduced readings that are not accurate of our true blood pressure. So things to keep in mind. So you should try to avoid these things so that we're getting the best reading. So do not smoke or drink caffeine for 30 minutes before taking your blood pressure reading. Do not measure your blood pressure when you are upset or in pain. It can increase your blood pressure reading. You want to empty your bladder or your bowel, so go to the bathroom first before you check your blood pressure. You want to sit quietly with your feet flat on the floor and back against a chair for at least 5 minutes before you take your blood pressure reading. You want to use the same arm each time. So every time you're taking your blood pressure, to be able to compare it, you want to use the same arm to take that reading. You want to make sure that you have no clothes on your arm when you're taking that reading as well too. Nothing to add any pressure or to feel very tight on the arm. For our cuffs, you want to make sure that you have, I always say to just remember the 2-finger rule. So when it comes to putting your cuff on, you want to make sure that you can at least put 2 fingers in between your cuff and your arm. That's how you know that it is tight enough to get an accurate reading. If it's too loose or too tight, it can throw off your reading. As well, when you're putting that cuff on your arm, you want to make sure that it is 2 fingers above, so 2 fingers width above your elbow. So where your elbow crease is, you want to make sure that that cuff is at least 2 finger widths above your elbow crease. So that again, we are not having inaccurate readings. You also want, this is a big one because I see some people taking their blood pressure with their hand down. You want to place your arm on a table or a firm surface because the cuff must be at the level of your heart or else you get thrown off readings. So when you're taking your blood pressure, your heart is here. Sorry, on my left side, your heart is here. You want to make sure that your hand is up high enough where it's in line with your heart to give you an accurate reading. And lastly, you guys can tell me if you fall prey to this one, is you should try not to talk or watch TV while taking your blood pressure. Depending on what you're watching or depending on what you're viewing and your environment, it can really throw off your reading. So if you're watching a TV show that is like high adrenaline, like there's something really enjoyable happening in it, it will affect your blood pressure. So with that being said, is there anything on that list that anyone thinks they weren't doing while taking their blood pressure before? I don't know if the mics can be open, but
I talk too much.
yeah, you can see if there's anything on that list that you were doing before, or just to be mindful of when you're checking your blood pressure in the future.